Hello, everyone. I'm Jean Giddens, Dean of the VCU School of Nursing. Welcome to our 2022 reunion weekend. I'm pleased to be able to share an update with you on what's been happening at our school for the past year. To start off, I'd like to recognize classes ending in 2 and 7, and also our St. Philip and Grand alumni. We hope you'll have a chance to reconnect with your classmates in some of the events that are planned. I'd also like to specifically acknowledge the class of 1972 who are celebrating their 50th anniversary since graduating from VCU. Thanks for being part of the reunion weekend, and I hope you'll fondly recall many positive memories from when you were a student at our school. Before I share updates on what's been happening at our school since last year, I'd like to take a moment to introduce 2 members of our school's leadership team. After a national search, we were pleased to promote longtime faculty member Suzanne Armringer as our new Associate Dean of Academic Affairs. She's nationally known for her outstanding scholarship and research, and in fact, she previously served as the Assistant Dean, then Interim Dean for Research Scholarship and Innovation. She's also served as the PhD Program Director at our school. Through these experiences, she realized she enjoyed academic leadership. We also have another new Associate Dean, Dr. Shelley Conroy, who's a 2-time alumna of our school and a former faculty member. She has joined us as Associate Dean for Graduate Programs and Chair of the Department of Adult Health and Nursing Systems. She served as Dean of the School of Nursing at Baylor University prior to coming to VCU. A nationally known leader in nursing education, she has more than 40 years of experience in academic nursing. We are so pleased to have her back at VCU as part of our team. Now, I'd like to share a few updates focusing on some of the new initiatives to advance our academic programs. As you know, the university returned to full campus operations in the fall with masking and vaccine mandates. Everyone adjusted well to the full transition back to our building. Recently, the university adjusted its requirements so that masking is optional, except in classrooms, clinical areas, and public transit. Vaccinations are required by health systems for students participating in clinical learning. The university continues to monitor and implement best practices related to COVID-19. This past fall, we began offering a baccalaureate entry in our Doctor of Nursing Practice program. Previously, a master's degree was required to be eligible for admission. This option provides a streamlined and more affordable way for students to earn their degree and also aligns with national trends in nursing education. This winter, we were fortunate to add Reynolds Community College as our 4th partner to our RN2BS co-enrollment collaborative. Our other partners include Southside Community College, Rappahannock Community College, and John Tyler Community College. Eligible students in these partnering schools will be eligible to earn their bachelor's degree faster by taking several classes from VCU while enrolled in the community college. And our school is able to offer full scholarships to these students. It's a win-win for everyone involved. While we're on the topic of academic programs, I'm pleased to share that we continue to be ranked among the top nursing programs in the nation. In the latest U.S. News & World Report rankings, our undergraduate program is ranked among the top 4% in the nation at number 23. And in addition, our online master's program is number 20, our specialty in nursing leadership and organizational science is number 9, our master's program is ranked 34th, and our DNP program is ranked 35th in the nation. This speaks to the high caliber of our faculty, students, and programs. Another important measure of the quality of our programs is accreditation. This past year, we received 10-year accreditation approval from the Commission on Collegiate Nursing Education. We also gained another 10-year approval from the Virginia Board of Nursing. This is evidence to our ongoing commitment to providing a high-quality education in support of the current and future nursing workforce. Our enrollment remains strong despite the impact of COVID-19. A total of 912 students were enrolled last fall, with 538 undergraduate students and 374 graduate students. In December, 142 students graduated from our school. Things almost felt normal, except for the fact that everyone had on masks. Our clinical partners were thrilled to accept them into the workforce. Let me share with you a couple of examples of our stellar graduates from the class of fall 2021. Tiffany Height, a labor and delivery nurse at Vidant Health in Roanoke Rapids, North Carolina, is a graduate from our RN to BS program. She found her calling in nursing after a career in banking and as a second grade teacher. She hopes to eventually become a nurse practitioner or a nurse midwife. Laura Stevens graduated from our accelerated bachelor's program. While in school, she worked with Dr. Patricia Kinzer on 2 research projects involving pregnancy and postpartum women. Prior to coming to VCU, Stevens served in the Army and worked as an X-ray technician. She wants to continue doing research and plans to apply to our doctoral program in the future. Now, I'd like to share some updates on our research activities. Our faculty and research staff have been really busy submitting numerous grants and applications and working on current projects. These efforts are paying off. For fiscal year 2021, the total sum of funding awarded was over $4.6 million. And for this fiscal year 2022, we have $6.4 million in total awards. So far this year, our faculty and research team have already submitted 23 grant proposals. And so their work continues. Let me share just a few examples of the great work underway at our school. Amy Salisbury and Patricia Kinzer are co-leading an NIH-funded project to study the impact of long COVID-19, specifically in infants, children, and adolescents. This is part of a $470 million NIH initiative that puts us in the company of top research institutions working on this project nationwide. This is a huge opportunity for our school, and I'm so proud that we are part of this project. In another project, Patricia Kinzer, on the right side of the photo, is co-leading a $2.5 million 5-year grant from the NIH and National Institute of Nursing research with Dr. Susan Bodner-Duran from the Department of Sociology. This study is investigating the impact of mindfulness activities and social connectedness on people with depression while pregnant. Working with underrepresented older adults is the focus of another project involving a researcher from our school. Lana Sargent is co-director on a $1.2 million grant from the U.S. Department of Health and Human Services. Dr. Sargent and other team members are working with low-income older adults to improve care access and risk reduction services around Alzheimer's disease and other related dementias. Now I'd like to share some of the recent national awards and recognitions that our faculty have been honored with. Last fall, we were thrilled to celebrate our newest fellows of the American Academy of Nursing, Dr. Amy Salisbury, our Associate Dean for Research, Scholarship, and Innovation, and Dr. Shelley Smith, our Program Director for Graduate Programs. Their induction brings the total number of fellows at our school to 9, which is a great reflection of the caliber of faculty at our school. In another national recognition, Dr. Terry Jones, who's an associate professor and concentration lead for the Nursing Leadership and Organizational Science program, received the Academy of Medical Surgical Nurses President's Award for service. Our faculty are making an impact here in Virginia as well. Patricia Kinzer has been reappointed to the Virginia State Board of Health for another 4 years. We're really pleased to have representation from our school on this important board. And one more honor to share. I'm very humbled and pleased to share that I have recently been elected as chair-elect of the Board of Directors of the American Association of Colleges of Nursing, also known as AACN. I'll serve as chair-elect for 2 years and then assume the role of board chair from 2024 through 2026. Now I'd like to share several of our key initiatives from the past year. In 2021, we entered into a faculty practice plan agreement with the MCV physicians, an initiative led by Dr. Pam Parsons. The formal agreement provides the opportunity for VCU School of Nursing faculty who are nurse practitioners to practice for up to 2 days a week. This long-awaited practice plan integrates clinical practice as part of the faculty member's role within the school. And it also enhances opportunities for precepting our own nurse practitioner students. As many of you have heard, the AACN has recently revised the standards for nursing education, known as the Essentials. Our school has formed an implementation task force called NetForce, composed of committed faculty and staff. Their goal is to redesign the curriculum for all programs in alignment with the new Essentials by September 2023. The Langston Center continues to offer rich programs that advance dialogue on innovation in healthcare. A virtual colloquium addressing health equity in Virginia was held in the fall, featuring scholars at VCU and leaders across Virginia. And just recently, the center held a quality forum on the topic, Planetary, Environmental, and Social Justice, a new lens for quality, safety, and innovation. Another important ongoing initiative is our diversity, equity, and inclusion efforts. Dr. Angela Duncan, our Associate Dean of Diversity, Equity, and Inclusion, is leading our commitment to conversation and reflection and action to ensure a welcoming environment for all. Among the tactics she has put into place thus far include a DEI council. She's provided guidance for student orientation, and she has facilitated diversity training. She's also organized 2 recent events, including the panel discussion on medical racism and maternal health crisis, pictured here. One area that we continue to see steady progress in is the diversity of our student body. As you can see in these charts, as of fall 2021, we have increased our student diversity to about 40%, compared to about 29% in fall 2013 when I first arrived. We are also making good progress in increasing the diversity among our faculty and staff. We increased our minority faculty from 11% 7 years ago to 19% in fall 2021. Among staff, diversity is currently at 39%. Our school can only be better and stronger with a diverse community of faculty and staff. The final thing I'd like to share is an update on our fundraising. Thanks to the generosity of our donors, including many of you, our school raised over $3.2 million in fiscal year 2021, with the bulk of it in support of student scholarships. This year, our development team has already raised over $3.5 million, which is 127% over our goal, and we still have a couple of months before the end of the fiscal year. We thank all of you for your contributions to our school's success. Well, that about wraps up our school updates for this spring. I'm sure you can see why I love this school and why I'm so proud of the accomplishments of our faculty, staff, and students. Thanks for joining us.